Hello, I'm Mike Agajanian. I'm a former member of the Armenian Eye Care Project Board of Directors, and I'm an adjunct professor at Worcester Polytechnic Institute in Worcester, Massachusetts. I have been working here in Armenia for the last 7 weeks as a project advisor in what we hope will be the new WPI Armenian Project Center. I had the pleasure of bringing 8 engineering students here to Armenia to work on 2 very important and impactful projects. One that we did with the Armenian Eye Care Project, and the second one that we did with the Smithsonian Institute. These projects were both important and impactful, and they forced our students to think critically and apply their problem-solving skills to address a social problem. Unfortunately, they finished their project on Friday of the week before you arrived, and so they're not here to present their project in person. So we created this video to give you an update and to give you some idea of what they did. Before I hand it over to the students, I want to thank Roger, Nune, and the staff of the AECP for one, having faith in us to be the inaugural program and do the first project with us. Second, to give us a very warm welcome and their support throughout the project. And then lastly, for identifying such a great project for the students to work on. It's been an honor to serve such an important organization as the Eye Care Project. Thank you.
Thanks for watching this video. I'm Alex Alvarez and I'm studying aerospace engineering.
I'm Julie Dunn and I'm studying biomedical engineering.
I'm Katie Dunphy and I'm studying industrial engineering.
And I'm Alex Lemon, studying mechanical engineering.
The first thing we did was we visited the SPTAC and Ichiban regional centers to assess the needs of the AECP with regard to data storage and sharing. Currently, paper records are being used to store patient information collected during visits, and unstructured teleconsultation is used for communication among doctors. We believe that the current state could be improved by replacing the paper records with an electronic medical record, or EMR, and by adding structure to the current teleconsultation operations.
An EMR is a digital patient chart which can replace the AECP's current paper record system. The AECP is a very unique organization, and as such, we decided that open source EMRs would be the best solution for the AECP. They're extremely low cost and can be modified to fit the needs of the organization. We worked with the AECP to understand the necessary features of the EMR and their goals around the integration of such a system in their practice. This allowed us to objectively assess how well the EMR would be able to address the needs of the AECP. We recommend OpenEMR as it is the most popular browser-based open source system. OpenEMR is usable in English and Armenian, making it accessible to clinicians and specialists abroad. Plus, the quick implementation time, easy to navigate patient portal, and very simple ophthalmology module which is conducive to the clinic makes OpenEMR the best system for the AECP.
To support the operation of its EMR, we recommend that the AECP install a decentralized network of low-cost servers at each of its regional centers and in Yerevan. Each of these servers will store patient data collected from all sites, allowing each to act as a backup for the rest. Because each server can be accessed over the local network, medical staff can continue to use the system during internet outages, and the built-in redundancies inherent to this approach allow users to work around issues such as equipment failures that would paralyze the system if it were hosted on a single traditional third-party server. We also recommend that the AECP invest in supporting equipment such as UPS power supplies and external backup drives. IT staff will need to be available to install and maintain hardware, but the solution was devised to fit within the contractor's skill sets and the AECP's available resources.
A common teleconsultation system is the Polycom. Polycom systems are closed connection computers that allow for real-time video conferencing between 2 or more systems. They also allow for outside device input such as surgical microscopes or slit lamps. Currently, the AECP has access to 3 of these Polycom systems, and we were able to set them up at the Center of Excellence, Malign Ophthalmological Center, and SPTAC Regional Center. We successfully had a call from the Center of Excellence to SPTAC and had great audio and video quality. We were also able to connect the surgical microscope, but it wasn't great quality in that regard, so we didn't include it in our recommendations. From our research and this testing, we developed a teleconsultation guide, which included an installation guide to help IT personnel set up future systems, as well as a user manual to help doctors and nurses use the Polycom systems. Through the use of these Polycom systems and the teleconsultation guide, communication between doctors will improve due to real-time conversations. Additionally, patient care will improve as consulting specialists can directly interact with the regional doctors and with patients.
In terms of teleconsultation operations, we first developed a design for a more structured teleconsultation system, which included two main parts. First, a contact list of AECP doctors, both in Armenia and around the world, was compiled to provide more resources to doctors in the regional eye centers. Next, an escalation protocol was developed to help doctors determine what consultation action to take based on a variety of factors, such as the urgency of the patient's condition and the availability of the specialists. Doctors using this provider contact list and escalation protocol in tandem would be able to improve patient outcomes by reducing referral rates to Yerevan and other clinics. This would result in better operations for the regional clinics, as well as patients having to spend less money to travel to Yerevan for referrals.
Thank you again for joining us today, and we'd like to express a special thanks to everyone who made this project possible. We hope you enjoy your time in Armenia just as much as we have.